We're going to be talking about the positions of the foot during a normal gait pattern walk. There's 8 total positions. 5 of them are the pre-swing and 3 are in the swing phase. The first step is the heel strike phase, where your heel would touch the ground. In the ankle joint, the anterior tibialis is the muscle being innervated. It's an isometric contraction, and it's being used by the deep peroneal nerve. In the knee, the quads are experiencing an eccentric contraction, and the nerve is the femoral nerve. In the hip, the glute max is being activated in an isometric contraction used by the inferior gluteal nerve. The second motion is foot flat. This is the loading response. In the ankle, the anterior tibialis is in a eccentric motion, which is innervated by the deep peroneal nerve. In the quads, it's in an eccentric motion, innervated by the femoral nerve. And in the hips, it's the glute max in a concentric contraction, innervated by the inferior gluteal nerve. During mid-stance, the gastrocnemius and soleus is being innervated. This is the preload. It's in an eccentric contraction, innervated by the tibial nerve. In the knee, there's use of momentum. And in the hips, the glute max and glute medius are being activated with a concentric and isometric motion by the inferior gluteal nerve and the superior gluteal nerve. During the terminal stance would be when the heel is off. During the heel off portion of it, the gastrocnemius and soleus are in an eccentric contraction, innervated by the tibial nerve. The knee is experiencing momentum, so it's the iliopsis is the muscle being activated. In the hip, it's in an eccentric motion, innervated by the femoral nerve. For the last one, the toe off, this is the pre-swing. The gastrocnemius and soleus are in a concentric contraction. The tibial nerve innervates that muscle. And in the hips, the iliopsis is in a concentric contraction, innervated by the femoral nerve. In the swing phase, the early swing, it's innervated by the anterior tibialis in a concentric contraction by the deep peroneal nerve. For the iliopsis, the femoral nerve is innervating it, and it's in a concentric contraction in the hip. So this is the early swing, like that. The mid swing, the muscle being innervated by the deep peroneal nerve is the anterior tibialis. It's in an isometric contraction. The knees are in motion. And for the hip, the iliopsoas is in a concentric contraction, innervated by the femoral nerve. Back down to the terminal swing. We're getting towards the end of the swing phase, making the cycle going back to the heel strike. The anterior tibialis is innervated by the deep peroneal nerve, and it's in an isometric contraction. The hamstrings are in an eccentric contraction, which is innervated by the sciatic nerve, and the glute max is in the eccentric contraction, innervated by the inferior gluteal nerve. So those are the motions